Lowell Frangy, City of Menominee.
Greg Camber, Great River Resources.
Overbat, Mayo.
Sandy Scott, Stout. Janice Raymaker, Stout.
Jeff White, Harry Tracy.
Mary Bauer, OSHA. Jennifer Strong.
We had two of you. Okay, we had a couple people at the same time. I heard Jennifer.
Yep, Jennifer Strong, medical advisor for Dunn County and also Marshfield Clinic.
Okay. And who's
Matt Mikesell with Walmart, DC.
Oh, yeah.
Sheila Story, Judiciary and Law.
Jeff Tucker, Craig Black.
O'Neill Gatsby with Red Cross.
Representative Rob Summerfield.
Bill Yings, School District of Colfax. Tetsuo Andrews Bell, State Patrol. Quentin Pop, Sand Creek Fire, Dunn County First Responders.
Okay, so it looks like we might not have our chair and our vice chair, Marie, checked, and we can default to Steve to run the meeting. So that is what we're going to do. So we'll hand it over to Steve Finley and we'll start the meeting from here, okay?
Okay, can everybody hear me? This is Steve Findlay. Good morning.
Yes.
Okay, call to order item number 1, roll call item number 2. Okay, item number 3 on the agenda is the COVID-19 update, and we have our health director, KT Gallagher, here that'll provide that for us.
I think that's important. So we want to double check with roll call. We heard who was on the phone and joining us electronically. We've got a couple folks in the room, so just so that everybody knows exactly who's here. This is KT Gallagher. I'm the Dunn County Health Department Director. Steve, you've already introduced yourself. Melissa, have you introduced yourself?
Oh, I did on the phone when
Perfect.
I asked him to roll call, but
Perfect. And then we've got one more visitor in the room. Can you share who you are?
I'm Steve Hansen from Wiz Community. I'm videotaping the meeting.
Thank you so much. So let's jump back to the COVID-19 update. I think what's really important and why we have maybe a little added interest in our meeting today is because we have had our first positive COVID-19 case here in Dunn County. I want to start things off recognizing that privacy is important, and so I will not be sharing information about this individual that can then trace back to exactly who they are or where they live, so please don't ask. That being said, this is something we anticipated happening. We anticipated that we would have COVID-19 positive cases and that it really was a matter of time because we have an amazing community that travels for work and travels for life. And it was a matter of just time. And so now with this case, we have somebody that we anticipate really was exposed through travel. This individual travels internationally as well as domestically and has traveled in the last 2 to 4 weeks, both internationally and domestically, to places identified by the CDC and by state health departments as having community spread. That being said, we are working, because this is what public health does, we are working with that individual to identify all of the contacts that they have had in the last 2 to 4 weeks, which is substantial. Not too many here, but substantial in the travels that they've had, and really following up with them on the guidance to self-isolate, self-monitor, and if they do experience symptoms, within 2 weeks of having had contact with this positive COVID-19 case, that they call their doctor or their telehealth line and let them know that they have been exposed to a confirmed positive case, and they would want additional instructions. The CDC is recommending, and the state is as well, that if you are asymptomatic or mildly symptomatic, that you really do work that through at home after connecting with your medical provider to let them know. But in order to be good stewards of resources, medical resources, and really leave testing kits and advanced support for those that are the sickest in our community, they will be asked to likely stay at home and convalesce or get better at home. It's still important to share that people's likelihood of getting COVID-19 is still really low, even in areas where there are community spread. It is also important to know that social distancing is one of the best ways that we can keep our community safe. What we're starting to understand better about COVID-19 is there is a segment of the population that is asymptomatic when they are sick with this, and then, or infected rather, and then there is a large contingent of the population that is sick with this that are really mildly symptomatic. Things that a healthy adult wouldn't think twice about. A little bit of a sore throat, a little bit of shortness of breath, a low-grade fever. And so without real careful self-monitoring, those symptoms can be oftentimes overlooked by busy folks that have a project deadline at work or have kiddos that need 10 things before 8 a.m. It's just really easy for us to go about our day. And so that social distancing, if somebody was to be asymptomatic or somebody was to be mildly symptomatic and not heeding public health's request to stay home, that 6 feet is really going to give an added level of buffer from transmission. And then additionally, this doesn't change what we're asking people to do. We're already asking people to have good hand hygiene. Consider washing your hands when you walk into a new building. Consider absolutely wash your hands before you eat and after you use the bathroom or cough or sneeze. Good respiratory hygiene. I still watch people last night cough into their hands. Don't do that. Cough into your elbow. Also, stay home when you're sick, and so that's why we're asking people to self-monitor. It's really easy for us to think, you know, night sweats aren't that big of a deal for me, I'm going through the change. Or it's not that big a deal to say, you know, I always have a little bit of shortness of breath because it's my allergies. At this time, really know yourself and know your symptoms, and if there's anything that's not right, stay home. So that's our local situation. I think state and national numbers, just as soon as I get them, they are out of date. And so from the DHS's website this morning, there were 155 cases. Recognizing that my case wasn't there, St. Croix's case wasn't there, Chippewa's case wasn't there, we know it's an outdated number. We have just had our first 2 deaths associated with COVID-19 in the state. And the governor's office did put out a press release associated with that. HIPAA does not apply in the same way to folks that are deceased, and so they did provide some information about those individuals. One is definitely, or would have been considered a susceptible population, being older, but one was not. And so I think that that's really important. When we are asking people to stay home, we are asking them to do that for their community. Likely, if they get sick, they will be fine, 85% of cases are really mild, but it's for those other 15% where they have significant health impacts, including death, that it is very important that we flatten the curve and make sure that less people get sick overall, and those people that do get sick have the necessary medical support at our local hospitals to help them convalesce and pull through when they have significant health issues. And then nationally, more and more states are acknowledging that they have community spread. The CDC's website is being updated, and maybe not at the frequency that I would like as a public health professional, but if you pop over their website about cases in the United States and you pop over the state, they will tell you if there is community spread. I would encourage you to click on that state, and that will take you to the state website, and you can oftentimes data mine much more extensively down to the county. So for example, if you go to Minnesota on that website, you will see that they do have community spread in localized areas. You click on the website, it takes you to the Minnesota Department of Health, where you can see that there are just a handful, 2 or 3 counties identified with community spread. That helps us make more informed decisions about exposure. But I would caution folks, just because a state or a county doesn't identify community spread, doesn't mean it's not happening. And so really, if you guys take anything away today from our time together, now is the time to stay home. Just because the area in Florida that you have a great vacation planned doesn't indicate that it has community spread, doesn't mean that it doesn't, and it doesn't mean that you won't be asked to self-isolate and monitor for 14 days after returning. That's my update as it stands right now.
Any discussion or comment from the group?
This is Bill Yink, the Colfax School District. KT, what is the test result turnaround time right now? I've heard 4 days. Could you shed any light on that, please?
Thank you, Bill, for that question. So one of the reasons we're asking folks to, if they have been exposed and their symptoms are mild, not necessarily rush in for a test, is because we really want to guard those resources for the folks that need it the most. And so the state put out guidance, it all runs together. I think it was 2 days ago. We're going to go with that. Where they are prioritizing or tiering folks that are going to be tested for free through the state lab. And they're prioritizing folks that are symptomatic and hospitalized, and they are prioritizing healthcare workers with known or suspected exposure. We are getting private labs coming online. All of our health systems are testing through different means, meaning Mayo is testing through their own private lab. Prevea, I believe, is using Quest, also a private lab. Marshfield, we've had a couple come through, and they're predominantly at this time using the state lab. So as more private labs come on, there will be more capacity, but because the demand has not, or rather the capacity hasn't kept up with the demand just yet, where I was getting results 2-3 weeks ago in less than 24 hours oftentimes, now we anticipate 2 to 3 days after the lab receives the sample. And sometimes if it's being processed through the state lab of Hygiene and they are not in those top 2 tiers, so they're in tier 3 or tier 4, meaning the doctor doesn't have any known exposure and they have mild symptoms or no symptoms, but they want to have it tested, those tests can take a significantly longer amount of time because they'll fit them in when they can get them in. So I do know that there have been counties waiting on one of those tier 3 or 4 tests 4, 5, 6 days.
Thank you.
Sheila Story, Judiciary and Law. Are we coming any closer to having drive-up testing in the future, or do we have some plan of we might start to implement that?
Sure, thank you, Sheila. I'm going to answer and then I'm going to kick that over to our health system partners. So you will hear that there is both state interest and I would say frankly national interest in having a more representative testing capability to really understand more about community prevalence. But that has not been actualized just yet. I do know Mayo in Eau Claire has started drive-up testing for folks that have talked to a doctor and do have an order and are one of their health system users. That being said, is there anybody on the phone that can speak a little bit more to what your health system is exploring? Here in Menominee.
Good morning. This is Mary Biggs. I just learned today. Well, we've been working on a testing site location, an inside a building site, and I just learned this morning that we will be making it an outside testing center, so a tent or a drive-through or something like that. We anticipate getting that stood up probably next week. Our next site after the Eau Claire site is going to be Rice Lake, and we hope to have that stood up by Monday. And so we're hoping probably mid next week.
Thank you, Mary.
You're welcome.
This is Jenny with Purveya. We're in the process of setting them up drive-through testing in Eau Claire at our residency clinic parking lot, and then also in Chippewa Falls at that parking lot. So we're in the process of doing that today. The issue right now is I'm afraid to open it up is we don't have enough tests if it gets really, really busy.
Sure. Thank you, Jenny.
And can you still hear me?
Yeah.
Yes.
Just to clarify, just so that it's for patients that call in and they get screened. It's not just for people to just show up. So they will call and they'll use the hypnosis, and if they are told they need to come in and get screened. Otherwise, it's not just for people to show up and ask for a test. I think that's pretty much, I think Mayo's doing the same thing in Marshfield as well.
Right.
That's correct. That's what it is for Mayo as well.
I think that's also mirrors some of the language that we're seeing in the state and federal resources, is that we need to protect our healthcare workers, and we need to protect the resources, and we need to make sure that the folks that need to get tested are tested, but that we're not testing just to test. I think that many of us kind of have a misconstrued idea about what this test entails. It's not like a pregnancy test. It's not like litmus test or a pool test. It's not something that's packaged and you can do from the privacy of your own home at this point. And so it's really important that they have exposure and symptoms before we test, and that they don't have something else that explains what's going on, like a bacterial infection related to their COPD, or something else that is very much explains the symptoms that they're experiencing, and they don't have exposure. So I think that's important messaging for our whole community as well.
Good morning, this is Stephen. I apologize for getting on late. Joining now.
Good morning, Stephen.
Give my apologies.
This is Andy Bennard. I have a question regarding the testing. If someone is tested and the test comes back negative, do we know the chances or the probability that they could still have this virus?
Sure, so I'll start that off as far as a public health response, and then I know we've got some trained medical professionals on the call as well, and so I will ask them to keep me honest. So what I understand and what CDC is giving guidance on is and they've kind of got a flow chart that they're modifying regularly just to be more responsive, that if you have a known exposure, say you went to Seattle, I'm sorry, my phone is ringing. So you have a known exposure and you need to be tested. The test comes and you're symptomatic. So I'm sorry. Let me start that over. That was really confusing. I apologize, guys. So there are a couple things at play. So we want to know if you had a known exposure. We want to know if you have symptoms or not. And then that helps us decide how long you should be self-isolating or self-quarantine based on what you've got. So if you have a known exposure, say you went to Seattle, we're, as a matter of course, asking you to stay home for 14 days. With that being said, if you have mild symptoms, we want you to talk to your provider, but likely you're not going to be tested at that point. If you have a known exposure and you have symptoms that warrant, in consult, after calling your provider or telehealth, that warrant testing, then we are going to also ask you to stay home that full 14 days. There is a modification of that flow chart that allows for someone that doesn't have a known exposure and has a different diagnosis in addition to a negative test. And those folks are able to return to work. But that is something that I can send out to the folks on this call so that they can see that same guidance for discontinuation of self-isolation. I think it's important so that everybody can see what the state is saying. Any of the docs on the line want to add some clarifying points to that?
Yeah, this is Jennifer from Marshfield, and I would say that, at this point we are trying to conserve tests for those folks that need to be hospitalized and trying to keep everybody home that we can. If you don't need to be in a medical facility getting medical care, we're asking that people stay home. Obviously, if folks are having symptoms that would otherwise need something else, say ear pain or sore throat, that could be strep throat, those sorts of things obviously still need to come in to be seen, and so sometimes it's hard for patients to know the difference. But if it's mild symptoms, something that you wouldn't generally go in for, again, trying to get folks to stay home and isolate.
This is Paul Horvath from Mayo. Just one other point that I want to reiterate. It's important that we're not testing asymptomatic people. We're testing people with symptoms that could be consistent with coronavirus. And part of the rationale for that is that the characteristics of the test may be different in somebody who doesn't have symptoms. The risk for false positive or false negative may be different than somebody who's not ill.
That's a really good point. That's a really good point. And if you have a known exposure and you do have symptoms, that's going to give us a better sense of that, so we don't have a false negative or a false positive. Because if you're asymptomatic and you have a test today, you could still develop symptoms and be infectious for that whole incubation period between what they're saying earliest around 2 to 3 days up to 12 to 13 days. Some people going over or starting earlier, of course, just as the bell curve goes. But just recognizing that if we test on day 7, you still have the ability to then be infectious on day 10 or 12.
Sheila Story, judiciary law. To maybe move away from the testing, the other thing that has been talked about and that I'm wondering about is availability of hospital staff, the respirators, the ventilators, that kind of thing. If we're ready for that, if we have to go into that, you know, if the disease gets to that point, are we prepared? Are we ready, or are we going to get in trouble?
So I guess I'll start, and then I'll again ask our medical providers to keep me honest. So what we're talking about is really flattening the curve. So if we expect to see somewhere around 20% of our population getting sick with this, if they get sick with this in the same 2 weeks, there is no way any medical capacity or any area would have the medical capacity to deal with that level of infection. But if we still spread out that 20% over a longer period of time, so instead of 2 weeks being 6 weeks or 3 months, then those medical services for advanced support are going to be able to keep up with the demand. Does anybody want to add to that?
Casey, this is Paul Horvath again. I think those are exactly the right points. I can tell you that we heard from our supply chain experts last night from Mayo Clinic Health System, and I feel confident that we're as prepared as we can be as long as we continue to practice good social distancing and other infection prevention measures.
Thank you for that. And I think it's about all of us doing our part and not putting an undue strain with elective or non-emergent healthcare usages right now, so that we can free up those resources for folks that do need it. And we can also prevent unnecessary exposure to our medical partners, because again, if we've got folks that are mildly symptomatic or asymptomatic going in for, say, a sleep study or something elective, and then potentially exposing them in a way that could get them sick, I think we really need to consider reserving those or postponing those procedures.
Hi Casey, this is Lynn Castro, and I'm sorry I checked in late from 3M. Is there anything that anybody has questions of or needs to talk to me about?
Hi Lynn, thanks for joining us. I know that I owe you, as well as many other folks on this call, some updated guidance from the State Department of Health Services for employers. I am waiting with bated breath for that, and I have not forgotten. We're really hopeful that the state can provide guidance that can promote consistency, as well as minimizing risks of infection to other and infectious spread to other employees, while maintaining these important industries open and working. So just talking about our local manufacturing capacity for things like paper products and for masks and respirators or hand sanitizer. So we appreciate the good work that you guys are doing. We want to support you guys with that consistency while maintaining that buffer of safety as it relates to our best information at this point. I haven't forgotten. I'll get it to you just as soon as I have it.
thank you, Casey. Are there any other, we were still in the session period for the COVID-19. Are there any other comments or suggestions from the Okay. If not, then Steve and Marie, please correct me if I'm out of order here. The next item is public comment. And does anyone wish to ask any questions or go into any discussion there? Any questions or comments for any of the participants on the call, or KT, or when in emergency government?
Just one comment, Bill Yeats, Colfax Schools. I'd just like to thank KT. We've been working with her at Dunn County Schools throughout this and appreciate her support and information on that. That's my only comment. Thank you.
Thanks, Bill. I appreciate that you've been in lockstep with us on this wild ride. I know that all of the school districts have really worked hard to maintain the safety of their students and their staff. And you guys have been incredibly responsive as the state has kind of ratcheted down their guidance on both schools and mass gatherings. So I appreciate that. Thank you.
Really thank KT and everyone on the call for your efforts and the wonderful help here. So I appreciate everyone's time. Other comments or questions or thoughts?
Steve, this is Melissa Gillimack. I just wanted to ask everyone on the call or on the video chat to email Marie to make sure you let us know that you were here. We think we got a fairly good roll call, but we would just like to make sure that we do have the attendance correctly. So if you are on the call and listening, if you could just email Marie that you were here so that we do have an accurate count.
Thank you, Melissa. Other questions, thoughts, comments?
Are we going to do another meeting here next week or so, you think? Or?
This is Steve Findlay. I think the way we're doing it is quite successful, and we could sure stick with this. We wouldn't necessarily need a room unless public meeting rules dictate it. We'll keep the room open for those who would want to walk in, but this went pretty well this morning, so we could sure encourage people to attend this way.
That's a great point. If we can continue that, then, and Mr. Paul, did we come up with a next meeting date, or we could do that now and either make it next Friday or we what are your thoughts on that?
So next Friday makes sense to me. If we could move it back a half hour, I'd be very appreciative.
Sure. Then you'd be on my time, Casey.
I know.
No excuse. Again, I apologize. All right, well, I will check back with either Marie or Steve, KT, and in the meantime, thank you everyone for your wonderful job. We're in this together. It's a crisis. We're all trying to do what we can, and with the team, with this, and the wonderful job being done by everyone who's out there in the community. Yeah, so with Marie and Steve, we will go with next Friday at 3. March 27th, and we'll set up Marie up according to that with the city, and we'll have updates obviously for that.
Steve?
Yeah.
This is Sheila's story. I'm just wondering, since we have a legislature on the phone with Rob Summerfield, I'm wondering if he would have anything he might want to add to what's going on the state level, and if he's feeling good about anything that the county might need in the event that we need it, or just give us some kind of an idea of how things are going down there.
Okay, thanks, Sheila. Rob, did you wish to anything on that? Rob, someone from the legislature, do you prefer to answer any good questions? we're gonna get a response on that, which is fine. We'll continue to monitor, and if we get information, we can certainly pass that out to the committee as well as to other sources. Yeah.
Thank you, Steve.
Thanks, Sheila.
Yeah, this is Rob Summerfield. Can you hear me?
Oh, yes, thanks, Rob.
Okay, yep, sorry, I don't know what's, I'm muted, I should know this. I got the conference calls. Just quickly, things are very moving, quite, frequently. Currently have no really new information, but I've been telling everybody, if you got concerns, state level, give myself a call, shoot us an email, we can talk, what's going on. I know, our leadership teams, with the Assembly and Senate have been meeting daily with the governor and his staff. We are talking about numerous proposals, but at this time I have nothing, to really share, what we are going to do, but it could be changing in the next couple hours or days. So feel free to reach out to myself, my office, and we'll be happy to address concerns and see what we can do to help.
Thank you, Rob. And thanks, Sheila.
You're welcome.
Okay, well, if there are no other comments, no other questions, before we adjourn, and we will take up our meeting a week from now, and I'll be sure to take some time. And then in the meantime, we'll be working with our local government as well as state and folks that are on the call to keep things as much as possible. That's a great job that everyone's been doing. So thank you, everybody, for your call, for your time. We'll get through this. We're strong, we're resilient, and we'll get stronger with that. So appreciate everyone's help. If there are no other questions, then we can adjourn.
Thank
Thank
you.
you.
Bye, guys.
Thank you.
Thank you, Casey.